Okay, today we're going to be moving a patient from her bed to a stretcher, and so we're going to start by verifying healthcare providers' orders, performing hand hygiene, providing for patient privacy, putting on gloves if needed. I'll introduce myself to the patient. Hi, I'm Erin. I'm going to be your nurse today. And then I will ask the patient for 2 identifiers such as name and date of birth. And then I'll explain the procedure to her and her family if they're there. So we're going to start by putting the bed to a working height, and then we're going to lock the wheels of the bed, and then I'm going to have her fold her arms over her chest. And at this point there's going to be 3 nurses in the room because we'll identify how many nurses are going to be needed for how much she weighs, and typically that's going to be 3. And so there's going to be 1 nurse on the opposite side and 2 nurses here to pull the fan folded sheet. So we'll put the stretcher up next to the bed, make sure the wheels are locked. We'll put the slide board under her, and the other nurses will help do that. And then we'll pull the patient up or down onto the stretcher. The stretcher should be right at the bed height, but maybe about half an inch lower. And then after the patient's on the stretcher, we'll raise the rails of the stretcher, we'll put a blanket on the patient, and I will document the procedure and perform hand hygiene. Hi, today we're going to be transferring the patient from her bed to a wheelchair, and so I'm going to start by verifying the healthcare provider's orders, performing hand hygiene, providing patient privacy. I'll introduce myself to the patient. Hi, I'm Erin. I'm going to be your nurse today. I'll ask for 2 identifiers, such as what is your name and date of birth, and then I will explain the procedure to the patient. So we're going to start by making sure the wheelchair is at a 45-degree angle to the bed on the patient's stronger side. And then we're going to lock the wheels of the bed, lower the bed down so that it's at the same height as the wheelchair, raise the head of the bed to 30 degrees, and then we're going to start by having the patient roll towards me. So we'll roll this way. And then to get the patient up and out of the bed, I'm going to put my 1 hand on her shoulder and 1 hand on her thigh. And then I will help the patient up. Then I'll have the patient sit here for a few minutes to check her balance, check her for dizziness. And after a few minutes are up, I'm going to put on the skid slippers, or the non-skid slippers. Sorry. And then after I put on her slippers, I'll put on the gait belt. Okay, and then using the gait, I'm going to make sure that I can put 2 fingers between the gait belt, and that's it, just so she has a little breathing room, but that it's firm on her abdomen. And then to help the patient stand up, we're going to stand up using a rocking technique. So I'm going to put my hands on the side of the gait belt and have her rock with me 3 times before standing up. So I'll count 1, 2, 3, and then I'll help her stand up, and I'll be supporting, and as I'm turning the patient towards the wheelchair, I'll support her weaker leg with my knee, and I'll tell her to look for the edge of the wheelchair and the armrest as she sits down. And then I will lower the footrest, put her feet on them, make sure the call light is within reach. I will check her vital signs, ask if she's dizzy or fatigued, and then I will document. Today we'll be performing assistant with moving a patient in bed. So first I'll verify the doctor's order or the healthcare provider's orders, and then I'll get the necessary supplies. In this case, it's going to be a draw sheet and some extra pillows. Then I will walk in the room, perform hand hygiene, provide for patient privacy, introduce myself to the patient. Hi, I'm Erin. I'm going to be your nurse today. And then I will identify the patient with 2 identifiers. Can I get your name and your date of birth? And after they give that to me, I will explain the procedure that I'll be performing today. So first, I will move the pillow from the patient's head, have the patient cross her arms, cross her body. Yes, just like that. I'll make sure the bed is raised so that it's right at a comfortable height for me to move her. Then I will have another nurse here with me, but for now it's just me, so we're gonna pretend. I'll have her be rolled onto her side by the other nurse, so just roll yourself. And I will roll the draw sheet out halfway, and then I will have her roll back towards me, roll all the way, and have the other nurse unroll the rest of the draw sheet. Okay, and then move back. Perfect. And then to move the patient up in bed, I will take the draw sheet and I'll have the other nurse across me take the draw sheet too. Put your feet at a 90-degree angle and move my weight from my front from my front to my back foot as I move her up in bed. So just move up in bed. And move up towards the pillow. Okay. And then to perform the log roll, we'll move her back down. So move back down. Onto the log roll now. We'll make sure her arms are still crossed across her body. In this case, there would be 3 nurses in the room. We would start with assessing the patient's weight and assessing how much help we would need. In most cases, it's 3 nurses, but for now, it's just me, so we're going to pretend again. But there will be 2 nurses on the other side, and I'm going to roll her onto her left side, where the other nurses would be. So I'll fan fold the sheet, and I will pull up as the nurses pull her to that side. And then I will put the other pillows behind her for support. And then tell her she can relax her arms. Perfect. Then I will place the call light within reach, lower the bed, make sure the side rails are up. I will tidy up the room, throw away the supplies I used, I'll throw away my gloves, perform hand hygiene, and then I will document the procedure. Today I'll be performing assisting with ambulation using a gait belt. First I'll start by verifying the healthcare provider's orders, then I will gather my supplies, in this case it's the gait belt. Then I'll perform hand hygiene, provide for patient privacy, introduce myself to the patient and their family. Hi, I'm Erin, I'm going to be your nurse today. And then I would ask for 2 patient identifiers. In this case, I'll ask her what her name is and when is her date of birth. Then I'll explain the procedure to her and her family. Then I will get started with the procedure. So first I will help them up into a comfortable seated position after I lower the bed all the way and lower the side rails. Perfect. I'll let the patient sit here for a moment to assess her balance. And after a few minutes, I'll have the patient move your feet and your legs in a circular motion and do your other side. Perfect. And then I'll ask them if she's dizzy. Are you dizzy? No. Perfect. Then I will apply, first I'll apply the non-stick slippers, or the, whatever it is. Perfect, and then I will apply the gait belt. After applying the gait belt, I'll stand on the patient's side. I'll grab the belt in the middle of her back and help her stand up. Again, I will ask if she is dizzy. Dizzy? No. She's not dizzy, so I'll help her walk forward, right foot first, then left, then right. I'll be assessing her balance and her strength along the way. Ask her if she's dizzy again, and she is, so I'm going to help her walk back to her bed, right foot, left foot, right, and help her to sit back down. If she had begun to fall while we were walking, I would have helped her slowly to the ground. And if the patient was heavier and needed 2 nurses, then each nurse would have stood on the side of her and completed the same procedure. Then I will remove her gait belt. Help her back down to a comfortable position in the bed. I'll place her personal items within reach, and I'll put the call light here and explain to her when to use the call light. Then I will tidy up her room, and then I'll dispose of all the supplies I used, and I'll dispose of my gloves, and I'll perform hand hygiene and document the procedure. After, of course, I lower her bed and raise the side rails.